The fight continues tonight. The Clergy Community Coalition presented its final paperwork to the city in an effort to include the construction of a new public hospital on the November ballot.
I have in my hand the original document that we're going to be handing in to the clerk of the commission, Regina Blackshear.
Bishop Richard Cox with the Clergy Community Coalition says turning that financial disclosure statement in today was the final step so their initiative to bring a public hospital to the city can be voted on in the November election. The CCC tells me this is something the community desperately needs.
We've seen people crying because their loved ones died because there was no hospital for them to be taken care of.
Cox tells me public hospitals can treat patients even if they have no insurance. This comes after the old Good Samaritan Hospital in the city closed back in 2018. The CCC says they've gotten overwhelming support from the community with over 1,200 valid signatures, but they've been back and forth with the city commission after their proposal was labeled as invalid due to the failure to provide a financial disclosure statement. Now that that's been turned in, they want the city to back the initiative.
It worked in Cleveland, Ohio, and has been in existence for 200 years. Why? Because somebody at the county level, somebody at the state level, somebody at the city level, and the citizens wanted a public hospital.
Cox also adds for those in the community who want their voices to be heard, there are 2 opportunities to do so at the City Commission meeting this Wednesday at 6 p.m., along with July 23rd when the commission chooses to accept or reject the initiative being on the ballot. The CCC says they're hoping for the best but preparing for the worst. Cox says with enough community support, this vision can become a reality.